Dr. Cass, it seems that almost all discussions relative to drugs and to vitamins and to everything are centered around adults. Now, I know, especially in the area that you're very involved in, that there are lots of drugs that are given to children. I don't know that any of them have been tested on children. I know that many times they're taking two drugs, may have never been tested for interactions. What kind of problems does that look like it could generate, and how much do people really know about what to give children?
We have a real problem right now because the pharmaceutical industry has marketed to psychiatrists to begin with for adults. Then the age has then been pushed down lower and lower and lower. And I'm not sure that this is the best way to go about things because these drugs have not been tested on children. Children are on huge combinations of medications. Kids, very, very young children, are on some serious combinations of psychotropic meds. So they're being diagnosed. There's a lot of bipolar diagnosis in children. We don't know that they're bipolar. I mean, that's a diagnosis that's just based on the kid has mood swings or tantrums. Well, it could be that the child has blood sugar swings. They may be not eating appropriately. They're not getting the right foods. They may be deficient in, say, some nutrients such as chromium to help balance their blood sugar. So there are these things that we need to address way before putting them on medications. And then the whole ADD thing with kids on Ritalin and Adderall and so on, I think is for the convenience of the schools. And they're not necessarily learning better or doing better. They may be acting up less in class, but they're also suffering from suppressed appetite and stunted growth. We have no idea what this is doing to their brain cells, but just look at this. These are developing brains. You take very young children, or any child until they're fully developed, and their brains are being given these drugs that are actually blocking certain neurotransmitters and certain receptor sites. This has to have some effect. And then these children grow up. What kind of a brain are they going to be working with? And are they going to be dependent on some sort of medication for their whole life? Or are they going to turn to drugs of abuse because their brain is used to having that kind of stimulation?
So it's really a conundrum that we have to get very involved in and set some ground rules as opposed to everyone just saying, this is what we're going to do and really
the doctor said, the doctor said this is what we're supposed to do, so that's what we're doing. People have to question their doctor's advice. And this is happening. I mean, I get lots and lots of calls. I'm a psychiatrist in practice, and I get calls from people saying the psychiatrist recommended that my child be on Ritalin, Adderall, Prozac, Celexa, and some of the antipsychotics and some of the meds for bipolar illness. And the parent says, I don't want to do that. Do you have some alternatives? So I'm not going to say, well, okay, instead of the antidepressant, take St. John's wort or 5-HTP. Instead of the stimulant, take tyrosine, even though those, of course, work. But I first want to get a good diagnosis from my standpoint, not a diagnosis based on symptoms, but a diagnosis based on biochemistry. So I'll test the child's biochemistry. I'll see what their blood sugar level looks like. I'll check their neurotransmitters. You can do a urine neurotransmitter test. You can test their vitamins and minerals and essential fatty acids with a urine test. So we do this testing, or we do blood tests, and I get to see what's really going on chemically in that child, and then give a very specific, tailor-made program for that child so that their brain can be functioning optimally. And so we're not just putting a drug, a drug on top of a drug on top of a drug without really addressing what's the underlying issue. And so the treatments that I'm recommending are far safer, far more targeted, and actually far more effective.
I'd suggest if you have a child who's having problems that you bring, or someone you know someone is, that you either show them this video or make your doctor aware of it, because it's something that is extremely important to make sure that these kids don't get in a situation that they can't get out of. Thank you.
Thank you.